Good evening, everyone. My name is Elizabeth, the Education Coordinator for Marlene's Market and Deli. Tonight's special guest that we have with us is a local naturopathic doctor at the Federal Way Naturopathy Clinic located in Federal Way, Washington. We have Dr. Shizue. Thank you so much, Dr. Shizue, for joining us this evening. You have a
Thank
really great
you.
topic um, ready for us.
Yeah, I'm excited to present today. This is February, so heart health and cardiovascular health. So I'm happy to be here. Thank you for the introduction, Elizabeth. I'm going to pull up my slides for everybody, so just give me a moment. Okay, can everyone see that? Okay, excellent. So the presentation today is called Fuel for the Heart, Nutrition for Cardiovascular Health. So we're kind of going to be going over evidence-based strategies for improving your heart health. And again, my name is Dr. Shizue, like Dr. She's away, like she's gone away, but she's not away because she's here. Just a tiny bit about me. I got my undergraduate in bioengineering, and then I just recently graduated from Bastyr with my doctor in naturopathic medicine. And I'm currently doing my first year of residency in primary care medicine at Federal Way Naturopathy. So just a quick plug for those of you who might not be super familiar with naturopathic medicine. So naturopathic doctors are licensed primary care physicians in Washington. So we utilize tools like lab testing, diet, nutrition, lifestyle, physical medicine, and herbs to treat the root cause of someone's symptoms. We're also able to prescribe most medications as needed. So one of the things that naturopathic doctors excel at, in my opinion, is prevention. So we work with you to prevent symptoms before they can progress into diseases. Okay, so on to the topic. So I'm going to go over a few of the most popular diets for cardiovascular health. I just want to say there's a ton out there, but I'm just going to go over ones that have the most evidence surrounding them. So if you know of others or have experience with others too, I'd love to hear them. First up is the classic Mediterranean diet. So the Mediterranean diet emphasizes plant-based foods and healthy fats. So while you can eat foods that are endemic to the Mediterranean area, I encourage more of a loose definition of the Mediterranean diet where you are eating plant-based proteins, vegetables, fruits, whole grains, beans, nuts, and seeds. And then olive oil is a pretty key part of this whole diet. And it's the main source of your fat. So just a quick little thing about all the different proteins and carbs and fats as part of the Mediterranean diet. So why are we even talking about the Mediterranean diet? What does research say? So research says that the Mediterranean diet can lower your risk for cardiovascular disease and a lot of chronic conditions. So it can lower your cholesterol levels. It can enhance your ability to absorb blood sugar. It can reduce chronic inflammation, and then it can help your arteries stay really flexible and resist plaque buildup. So one of the big studies around the Mediterranean diet is called the PREDIMED study. So this was a randomized, controlled, multi-center clinical trial of the Mediterranean diet versus a low-fat diet. And this is all for the prevention of cardiovascular events in about 7,500 people, both men and women between the ages of 55 and 80. And the follow-up was around 5 years. So this is a long-term study, and you got to see really what happens when people were on a Mediterranean diet versus a low-fat diet. And so what they found was there was a 30% reduction in heart attacks, stroke, and death. And the effect was most strong for stroke reduction. And also the effect was strongest in obese individuals or people who were overweight. And so I put in kind of the qualifications for what they said around the Mediterranean diet and what they recommended. And I want to note that there is no restriction around calorie intake. And in fact, If you notice the olive oil, they ask for over 4 tablespoons of olive oil per day, which is a pretty significant amount, right? So that's a significant amount of fat. And they talk about tree nuts and fruits and vegetables, fish, in particular, more fatty fish and seafood, legumes, sofrito, which is sort of this mix of onions and peppers and things like that. White meat, which is more of the chicken, turkey, pork kind of thing. And then a lot of people would like this, but the wine with the meals, right? The red wine with meals. And they discourage soda and baked goods and fats that are spreadable, as well as more processed meats and red meats. So really interesting study, and it really supported the Mediterranean diet, which is really one of the strongest diets that most cardiologists will plug for cardiovascular health. The next one is called the DASH diet. The DASH diet just stands for Dietary Approaches to Stop Hypertension. And so I like to simplify it by saying it's essentially the Mediterranean diet plus a low sodium diet. So it's a really good diet for people who have elevated blood pressure or hypertension, but it can also help to lower cholesterol and reduce your risk of cardiovascular disease. So one of the most difficult parts of this diet is the salt intake. So you have to limit your salt intake to about 2,300 milligrams per day. And so that equates to about a teaspoon of table salt. And so there's a few strategies that you can use. You can use spices instead of salts and use like more plain vegetables or fresh vegetables and frozen vegetables versus canned, which have those hidden sources of salts. Restaurant foods are also huge hidden sources of salts, and then limiting processed and cured foods. So again, emphasizing fruits and vegetables and whole grains and plant-based proteins and fats and limiting sugar. The other part of this is to include more high potassium foods in your diet. And so potassium helps to decrease the heart rate and then also prevent plaque buildup in the arteries. So some really good sources of high potassium, like you kind of classically think of the banana as a high potassium food, which is true, but actually leafy greens have a lot more potassium than bananas. So we're thinking like spinach, kale, collard greens, things like that, as well as some root vegetables like carrots, potatoes, anything that lives in the earth. And then a lot of your quote unquote tree fruits. So things that grow on trees like apples, oranges, bananas, and then avocados, which technically are a fruit, but yeah, we kind of incorporated that in the vegetable section. Okay, so that's the DASH diet. The next up is plant-based diets. So plant-based diets are associated with a 40% reduction in coronary heart disease. And that means disease where you have plaque buildup right around those arteries of the heart. It's really the only type of diet that's shown to reverse heart disease, which is, again, why cardiologists, a lot of times, they really emphasize plant-based diets in general. So it can lower cholesterol levels, improve your blood pressure, reduce inflammation. And then generally, one of the reasons why plant-based diets are so successful is that they're lower in saturated fat and cholesterol, and then they're higher in fiber. And they also have a lot of plant-based foods contain a lot of nutrients within it, like inflammation modulating nutrients, fiber, olive oil, and antioxidants. Okay, just going to check the chat really quick because I can't see it when I'm in presentation mode. Okay, perfect. All right, next up, let's talk saturated fats for a moment. So saturated fats and trans fats. So these are the types of fats that elevate your cholesterol levels and increase your risk of heart disease. There's been a lot of studies around this. What does saturated and trans fat actually mean? So that's talking about fried foods, processed meats, animal fats, but like more of the really fatty things like fatty beef and pork and sausage. Dairy, kind of mixed reviews on that one. Chips and salty snacks and things like that, and then baked goods. So on this right side of this slide, I have a little infographic which shows there was a study of over 100,000 individuals, and they evaluated different diets as well as stroke risk. And those people who had higher vegetable fat intake had a 12% lower stroke risk versus those who ate more animal fats had a, well, I think it's 16% increased stroke risk. So very, very different kind of profiles, right? There are some talks around the types of saturated fats that you can eat. Like you can eat, those fried foods and processed meats, but coconut oil is a saturated fat, and grass-fed ghee and butter is a saturated fat. So how does that come into play with all of this? And I guess my opinion around it is technically, yes, those things do have saturated and trans fats included in them. It's true, but they cause probably less inflammation than these other types of foods that I have listed on this slide. So still good to eat, but maybe eat it in moderation, right? Don't eat coconut oil with every single meal. Maybe don't have ghee or grass-fed butter or anything like that with every single meal. But again, really lovely things to add in general, is as long as they're added in moderation, right? Okay, so you might ask, well, if I take out saturated fats, what do I replace it with, right? So you can either replace it with proteins, carbs, or other fats. So there's this one study that kind of looked at what happens if you replace your saturated fats with carbohydrates. We're talking about breads and grains and all that kind of stuff, versus polyunsaturated fats. And these are more of those plant-based fats, like nuts and seeds, like avocado, olive oil, and then fatty fish is also included in there as well. So thinking about like your omega-3s. And so what they found was that people who replaced their saturated fat with polyunsaturated fat had a 26% lowered risk of coronary heart disease versus people who just replaced that with carbs, which technically don't have any fat in it, or some of them don't have any fat. There was no risk lowering when you replaced it with carbs. So something to keep in mind. So fats are a great thing. Speaking of fats, what about the keto diet? It's kind of an interesting diet. There's been a lot of research around it. For those of you who are unaware, the keto diet essentially means that your diet consists of 75% fats, 20% proteins, and then 5% carbs. So kind of an extreme low carb diet. And I want to mention that there are like fruits and vegetables are considered to be carbs. So it would be limiting the fruits and vegetables part of this whole thing, not just thinking about whole grains and breads and things like that. So most studies to date, as far as I could find, are on the smaller scale, and there's both positives and negatives to the keto diet. So it kind of first came about as a diet that people used for epilepsy, and it became a diet that a lot of people used for weight loss. So people have seen significant progress in reducing their weight when on the keto diet. So the science around this is essentially that when you are not eating carbs anymore, which is your body's main source of energy, and it breaks that down into sugars that you can use in your body and your brain. So instead of going down that route and using carbs to have energy, your body will instead go into something called ketosis, and it'll try to break down fats instead. So that's the whole reason why you get a lot of weight loss with the keto diet. So there's some studies that suggest that it improves your blood sugar, like in people with diabetes, and it lessens your cardiovascular risk factors, like obesity. So really wonderful things. And then there's other studies that show that it spikes your LDL or your bad cholesterol, causes heart problems, and it can cause periods where you have lower blood sugar or hypoglycemia. So what does this all mean, right? Like, what does this mean for how I'm supposed to incorporate the keto diet or not incorporate the keto diet? So some things that I like to consider is that we just talked about saturated fats and the cons of saturated fats. So with the keto diet, they don't really take into consideration saturated fats at all. There are no restrictions around saturated fats. And so you can see a lot of keto diets where they include a lot of coconut oil and bacon and processed meats and red meats as part of the diet, right? Because they're high in fats. But again, saturated fats. Saturated fats can increase your risk of heart disease. There's also not a lot of long-term effects or known long-term effects of what happens when you're on the keto diet for a long period of time. So again, could be beneficial, but we don't necessarily know. Like, what happens if you're on the keto diet for 10 years? Does that increase your risk of cardiovascular disease, or does it decrease it? So it's kind of unknown at this point. The other consideration is intermittent fasting. So intermittent fasting is where you spend at least 12 hours, if not longer, of a period where you're fasting. So you're not eating during that period of time. And so again, during this period of time, your body doesn't have carbohydrates or sugars as fuel. And instead, it starts going into ketosis and it will burn your fat instead. So is intermittent fasting an alternative to kind of get you into that same state? Or is it a better long-term solution? I don't exactly know. So kind of consider all of these things, in my opinion, as someone who wants to build habits and someone who wants to not just encourage diets for a short period of time, but thinking about how to incorporate these as lifestyle choices into your life where you make the choices every single day over a long period of time. I don't know. There's room for short-term keto diet sessions, where you're doing the keto diet for a few months or up to a year. But I also think, how do you incorporate normal habits into your day-to-day life? Like, do I want you to be on the keto diet for 10 years? I'm not sure yet because the research hasn't shown that yet. So all these things to consider. Okay. And I also want to mention there's a lot of lifestyle choices for heart health too. I know we just talked about a lot of different diets, but I want to mention there's a ton of other things you can do for your heart health. And I'm just kind of like scratching the surface of all of this. One of them is movement. So the aim is to get at least 150 minutes per week of moderate intensity physical activity. And so that kind of equates to about 30 minutes of physical activity 5 days a week. And that is kind of a lot. So I think probably most people are thinking, does that mean I have to go to the gym for at least 30 minutes 5 times a week? Like, does anyone have time for that? So think about, instead of exercise in a more regimented way, it can be a regimented exercise, but it could also be like running around after your kids or your grandkids for 30 minutes. It could be vigorous house cleaning. It could be like running around the block. It could be fast walking with your friends. It could be any of these things. Anything where it gets your heart pumping a little harder for 30 minutes a day. Sleep is also a big one. So aiming for about 7 to 8 hours of sleep per night. So sleep deprivation is a significant risk factor for developing high blood pressure, heart disease, and diabetes. So it's important to prioritize your sleep every night if you can. Stress management. So this is one of those hidden things that people don't think about as much, but it's important to find ways to de-stress your mind and your body as often as possible. I recommend at least finding something every day to de-stress. So chronic stress can lead to high blood pressure and inflammation. Again, it can increase your risk of heart attack and stroke. So it's it's exploring what works for you for stress management. It could be as simple as a breathing exercise when you get off of work or when you're feeling overwhelmed. It could be exercise can be a form of stress management. It can be tapping. There's a multitude of things. It could be meditation. It could be prayer. So there's a multitude of things that you can incorporate as a way to reduce stress on a day-to-day basis, but you have to figure out what works for you. The next two are a little bit more obvious, but drinking alcohol in moderation, right? So I know we just talked about the Mediterranean diet and wine, right? Red wine. And there was a lot of studies for a while about how you can drink like a glass of wine per night. But now more recent studies have shown that you want to decrease your alcohol consumption as much as possible. Because again, it will increase your risk of cardiovascular disease. So really try to moderate your alcohol. So kind of the key for everything right now is everything in moderation, right? And then smoking. This is the one I will say, it is time to stop smoking. So Smoking increases the formation of plaque buildup in your blood vessels. So it is just not good for you, not good for your heart health, not good for your lung health. It puts you at high risk of a lot of chronic diseases. So if there is a way to quit smoking, find a way to quit smoking. And it's one of the most difficult things to quit, one of the most addictive substances that we have. But thankfully, there are a lot of ways around smoking cessation and supportive things out there to help you. Okay. I thought this would be kind of fun. My top 10 foods for cardiovascular health. So, number one, I have fatty fish. So, fatty fish, super rich in omega-3 fatty acids, and that helps to reduce inflammation and decrease the risk of heart disease. It will lower your triglycerides if that's something that you're monitoring on your labs. There's one study that showed that 2 grams of omega-3s were correlated with a 25% reduction in cardiovascular events. And again, that's heart attack, stroke, chest pain, angina, all of that. And that's a pretty mega dose of fatty fish and omega-3s. So we're talking about a fairly significant amount that you're eating on a weekly basis. So some examples of fatty fish to include in your diet, we're talking salmon, mackerel, trout, sardines. Be careful about mercury content in your fish. That's the one thing I will say. Be careful about sourcing for salmon too, making sure that it's more wild caught versus farmed. But again, things to consider. Extra virgin olive oil. So we talked about this a little bit with the Mediterranean diet. So they were talking about 4 tablespoons of extra virgin olive oil per day. So a lot of fats, but really delicious. Reduces inflammation. It is a monounsaturated fatty acid. And there's a lot of added nutrients in olive oil, like vitamin E, like phytosterols, which is that plant cholesterol. And again, this is the highlight of your plant-based oils and fats that we were talking about earlier. So look specifically for extra virgin olive oil, and that means mechanically cold pressed without any solvents, with low amounts of free oleic acid, something that's high in antioxidants. So finding ways to incorporate olive oil into your diet. One of the things I will say is with olive oil, a lot of people cook with olive oil as a way to get it into their diet. And while that is, a really good way or like good intentions, it's not great to cook with because it has a low smoke point. And it can kind of break down all of those wonderful antioxidants and all of those things that we love about the olive oil. So instead of maybe cooking with it, thinking about drizzling it on your food, on your salads, making your own salad dressings, which is a great way to, one, add a ton of flavor to your food and decrease the amount of salt that's in there, because salad dressings have a ton of hidden salt in them and oil. But yeah, something to consider. Instead of cooking with extra virgin olive oil, cook with a more neutral oil or even maybe a little bit of coconut oil instead. Berries. This is a classic one. So dark red, purple fruits like berries and pomegranates are super rich in antioxidants. So why do we want antioxidants? So it helps to reduce your bad cholesterol oxidation, helps to vasodilate all of your arteries. It decreases your platelet aggregation and adhesion, which means that it reduces your risk of blood clots, which is a really big deal. And then it, again, decreases inflammation. So some really good sources of antioxidants are blueberries, strawberries, raspberries, blackberries, all the berries, pomegranates, red grapes. Also thinking about like anything that is purple has anthocyanins in it, which is a very common antioxidant. And so thinking about like blueberries have a ton of anthocyanins in them. Also purple sweet potatoes, if anyone watched the whole like Blue Zones trend, Blue Zones like Netflix show, they talk a lot about that. So your goal is to aim for 1 to 2 servings of fruits per day. Ideal to have berries instead of other fruits. Berries are also less sugary than some of the other fruits out there, like some of our tropical fruits. And so it can be really good for someone who has trouble regulating blood sugars. A really fun fact, coffee is by far the largest source of antioxidants in the American diet, by far. Yeah, but consider we're not talking about Starbucks coffees with the added sugars and all of the flavorings, though super delicious. We're talking more about like the black coffee or coffee with minimal additives in it. So something to be aware of. But again, it's a huge source of antioxidants. So drink your coffee. Whole grains, number 4. So the consumption of whole grains is associated with the reduced risk of coronary heart disease, as well as decreased risk of mortality. So it decreases inflammation in the body. And part of this mechanism is through the gut microbiome. So fiber and whole grains will feed the gut microbiome, and it increases your microbial diversity. And they in turn will help decrease inflammation in your body. So the goal is to have about 90 grams of fiber or 3 servings per day, which is a ton of fiber. Oat, barley, psyllium, those are all things to help lower cholesterol. I kind of think of like whole grains and fiber as like little scrubbers in your arteries, help break down plaque and reduce plaque on your blood vessels in general. So great source of fiber. And if you're struggling with high cholesterol, this is something to incorporate into your diet. Fiber is up next. So dietary fiber is associated with a dose-dependent decrease in the risk of heart disease, which means that the more fiber you eat, the lower your risk is of heart disease. So I put this little fun infographic down here of your amount of fiber per day and your estimated risk of cardiovascular disease. So it will decrease over time. They only say about 70 grams of fiber per day, but like I said in the last slide, you can get up to 90 grams of fiber per day. So you still get that added benefit. So good sources of fiber, that includes beans, vegetables, fruits, whole grains. One really good way of incorporating fiber, getting fiber into your diet, is to add ground flax seeds into smoothies or cereals or oatmeal in the morning. If you add a couple of tablespoons of ground flax into your diet, it can be really significant in lowering your cholesterol and increasing your amount of dietary fiber per day. Also helps with gut regulation, with regular bowel movements. So again, really lovely thing to incorporate into the diet. Next up is nuts and seeds. So these are kind of a twofer. They have a ton of fiber in them and they have omega-3 fatty acids. So again, these things will decrease inflammation, reduce your blood pressure and your cholesterol. And it's a great source of those plant-based fats like we talked about. Chia is a lovely thing to have. If anyone has ever tried chia seed pudding, it's great. Kind of like tapioca pudding, but crunchier. Flax seeds, like I just mentioned, a couple of tablespoons of flax incorporated into your diet is a really good way of getting those omega-3 fatty acids and fiber at the same time. Hemp seeds and walnuts too, wonderful at decreasing inflammation in your body. The only thing I'll say about this is, as delicious as nuts and seeds are, just be careful about your portion size. It can be really easy to eat a ton of nuts, especially the more tasty ones like cashews, salted roasted cashews, one of my favorite things in the world, but you can't eat a whole cup of them. It will not be good for you or your gut. That's a lot of added fat, despite the fiber and omega-3s that might be in there. All right, leafy green vegetables. So we kind of talked about this earlier with the DASH diet, where it's a really good source of potassium, which again, lowers your risk of cardiovascular disease and then prevents plaque formation in your blood vessels. So leafy green vegetables, they're high in fiber. They're also a really lovely source of vitamin K. Vitamin K is a cofactor needed for blood clotting. So it helps to protect your arteries. It helps to properly blood clot. So it keeps that whole system really healthy. It's also high in nitrates, dietary nitrates. That can help reduce your blood pressure, decrease arterial stiffness, and then improve the function of all of the cells that are lining your blood vessels. So good sources: spinach, kale, collard greens, anything dark green and leafy and delicious that you can add into a bunch of different things. Sprouts, microgreens, can also be a really good source of getting in these leafy green vegetables, because sprouts are in that early nutrient phase where they still have all those lovely nutrients, but in a very small amount or very small space. So one of the things that I like to do is just add microgreens or sprouts to whatever you're eating. It doesn't have to be a salad. It can be whatever you're eating. Next up is beans, legumes. So plant-based protein, excellent source of fiber and resistant starch, which doesn't go through digestion, and it's feeding all of the bacteria in your gut. So helps improve your gut microbiome, which in turn will help reduce inflammation in your body. It also helps to reduce your bad cholesterol, your LDL cholesterol. It improves your blood sugar control, and it can decrease your blood pressure over time. Okay, garlic. Garlic is one of my favorite things. Super tasty, but it's also a very medicinal herb. So the big medicinal component in garlic is called allicin. And so allicin can help lower blood pressure. It inhibits platelet buildup, which reduces the risk for blood clots and strokes. And one of the things that you can do is either eat it raw, which can be quite spicy, but delicious, or if you crush it, just let it sit for a few moments to allow that allicin to kind of form before you cook it. So that's how you can maximize the medicinal components of your garlic. There's also even supplements out there that we prescribe often at our naturopathic clinic, which just contain allicin in it. It's a very powerful antimicrobial herb, and again, can help lower blood pressure and improve your cholesterol. This is my favorite one, dark chocolate. So it's hugely rich in antioxidants like flavonoids, but you want to consume it in moderation. I mean, you don't want to consume it all day, every day, right? You want about 6 servings or less per week, but it helps to reduce your risk of heart disease, stroke, and diabetes. But you want to make sure to choose a 70% cacao content in order to maximize your health benefits. The milk chocolate, although delicious, has more like 40% cacao in it. So you want to choose the higher amounts if possible, which also have lower amounts of sugar in it. Also thinking about helps you stay satiated so you don't crave even more of that chocolate after you pop in a piece. Yeah, so something to consider. Instead of going for a bigger dessert, you can have a few squares of dark chocolate, and you might find that you feel really satiated with just that amount. Okay, that was fast, but that is the end of my content for now. So I want to open it up for questions. Thank you so much for your attention, and I'm happy to answer any questions that you might have.
Thank you so much, Dr. Shizue. That was fantastic. Folks, if you have any questions, feel free to unmute yourself or enter in the chat box. Oh,
okay. Yeah, Nicole, you're asking what beans are the most beneficial? Really, any beans. Any beans that are easy to cook and you like. So thinking about lentils are a really solid option because they have tons of protein. And you can get some types that are very easy to cook, like they cook in less than 20 minutes, like thinking about red lentils or split peas or things like that. So a good way to add protein without causing a lot of heartache.
literally.
Exactly.
Yeah.
I had a question.
Oh,
Yeah.
Because I know we're supposed to eat not a lot of dairy. What about like plain Greek yogurt with no sugar or, none of that flavored stuff or anything in there. Obviously that within moderation. What is your take on the full fat versus the non-fat?
Yeah, I would actually go for the full fat ones, right?
It tastes good
Um,
too. Yeah.
it tastes much better. So again, you get satiated faster. But I have no problem with, full fat diet. Or full fat yogurt. I actually think that is a lovely thing to add into the diet, even
Okay.
though it has some more saturated fats in there. Again, don't eat it all day, every day,
Yeah,
but
yeah.
yeah.
And coffee, I love coffee. I don't go to Starbucks and put all that stuff in there. What is your take on like the oat milk? I usually buy like the organic, I usually get it from Costco or something like that. And I just put like a splash of that in my coffee. Usually I drink it black, but it's kind of a treat for me. Sometimes I'll put that in there, and maybe if I'm really wanting to treat, like just a little bit of good raw honey, like Marlene's has wonderful honey. What is your take on that with the oat milk? Because some people say oat milk is kind of processed and yeah.
hmm Um, there are some types of oatmeal milk that are more processed than others. For instance, there are some that have a lot of palm oil in there. So that can be a
Mm.
hidden source of like saturated fats and things that you weren't expecting to get in your oat milk. So just check your ingredient list in the oat milk and see if you can find one that has the fewest ingredients possible.
Okay.
One of the ones that I recommend is Malk. Malk has, I think, like 4 or less ingredients, and I think Marlene sells it as well. Um, and yeah, things like that. Just kind of read the package of whatever you're putting in and just make sure there's no hidden sources of fat and palm oil and things like that that you weren't expecting.
Very good. And honey within moderation, like the raw
Oh
honey?
yeah,
Yeah.
honey's
Okay.
great. Yeah,
Yeah, that's good. Okay.
yeah. Honey is also good as an antimicrobial too. So I would never say like restrict your honey. Love
Oh,
honey and maple syrup instead of more of like the added cane sugar. So if you're
yes.
baking, cooking, like making desserts or whatever, and you want some sugar in it, I'm all about the honey and the maple syrup.
Okay. Good to know.
Mhm.
What are your thoughts on coconut sugar?
Yeah, kind of similarly, coconut sugar is a fine substitute as well. Yeah, I would
Yeah.
add it. Some people don't like the taste of it so much, but you kind of figure out what works for you. Also can go for like the monk fruit sugars and things like that.
Yeah. Thank you, Susan. Those were some great questions. You have another one?
No, I can't think of any. I do sometimes I do have the pure powdered um cocoa, and it's beyond 70. I mean, it's just pure, it's very bitter. And I'll
Mhm.
throw that like in a smoothie or something sometimes. I get my tart cherries from Marlene's. Well, I work there. I get my tart cherries from Marlene's and my protein powder, and I throw that in a blender with some cocoa and the dark cherries and some oat milk. It's like a chocolate cherry milkshake. It's delicious.
That sounds amazing. And you got such strong components of like antioxidants in there. Just love it. Sounds delicious.
Yeah, thank you for the idea, Susan. I'm like, yum. I'm gonna have
It's
to
really good. It's a
have
nice treat.
some. Are the tart cherries in bulk?
No, they're over in the frozen area towards the very end, right very close to the produce aisle, near like where a lot of the vegan stuff is.
Oh,
There's the frozen, and I forgot which brand it is. It's the only one we have. And then there's also pie cherries that you would use to make a pie, and they're tart too. So we've got two options there.
ooh.
And of course, over in the supplements area, we've got all the wonderful protein powders, and got oat milk there and everything. So yeah, it's well, I can't say I never drink milkshakes, but it's really uh cut back on me going out for a milkshake, having one of those.
No,
Sounds
perfect.
lovely.
Hmm.
I know I'm making up some. Oh, Nicole had a question. Sorry.
Okay. Recently learned that stevia contains erythritol. Is this a risk to heart health?
Hmm.
I don't know about erythritol in terms of heart health. I mean, I know that it's actually great for the teeth. It's good for your dental health. Um, and it doesn't spike your blood sugar, which is good. But as far as I know, it doesn't necessarily, it's not negative to your heart health. Um, yeah.
Great question. Um, there was a question I had. What are your thoughts on like hawthorn? Like I've heard that that's like a like a good way of having good heart health. But I'm curious about what it does exactly.
Hmm. So hawthorn is a cardiovascular tonic. So it's an herb, and it's a hawthorn berries, and it can be really good at lowering your blood pressure a little bit for sure. But you need to make sure to have it in the right dosages. So a lot of people just have a little bit of hawthorn and think that that is enough. But with herbs, you have to actually dose higher than you think. So definitely talk to your naturopathic physician or your doctor and see what dosage is right for you. Also, don't want to lower your blood pressure too much to where you get dizzy and all of that. So it's a great thing to add. I love hawthorn. It's definitely the one of the herbs, like one of the main herbs for the heart. Also, really wonderful for people who have atrial fibrillation, where their hearts aren't beating exactly correctly. So that can be really beneficial for it. But again, dosing will vary based on what you're using it for.
Perfect. Thank you.
Mm.
And y'all there down at the clinic, you have like the like major like naturopathic brand like Thorn, I'm sure, and those types of supplements that are a little bit more um for therapeutic purposes, obviously, and to be prescribed by a wonderful naturopathic doctor, but y'all have all that available there, like a dispensary, right?
Yes, we do have a dispensary at Federal Way Naturopathy. And you are welcome to come and look at our supplements. You don't have to be a patient in order to check out our dispensary. But you can check it out and check out our facility in general and see if you vibe with the place. But you can see it's all organized by body system, which makes it really easy to check things out. And we have some things that you might not find at Marlene's and definitely different dosings of everything. But there are a few products that we absolutely refer to Marlene's for all the time, like throat coat tea. That's something we love. Like nasal sprays. There's a great clear nasal spray that we always tell people to go pick up at Marlene's. Yeah.
Oh, thank you. Well, and
Yeah.
um yeah, I was telling you, Marlene and Dr. Elizabeth were like really close friends, and so our partnership with Federal Way Naturopathy runs deep, and I'm just very grateful to work with you and that you're just a lovely addition to the Federal Way Naturopathy family.
Well, thank you so much for having me. I really appreciate it. Love being included in this lovely family.
Oh yes. And it's great because we're able to all what's great about these classes is that it brings the unity back to the community. And we got to stick together and be happy and healthy and whatever we can do to help support that, especially amazing practitioners like yourselves, making a difference in people's lives and also dedicating your time tonight too. So
I'm more than happy to be here. This is one of my favorite things to do.
yay! Oh yeah, and you're speaking. Oh golly, where'd that go? I just had it. You're gonna be speaking back with us Thursday, May 16th.
Mhm.
Mark your
Yep.
calendars, everyone. Oh, Nicole said I'm taking Thorn prenatals now. I didn't know they made prenatals.
Yay. They do. Yeah. They have a wonderful prenatal blend. So lovely that you're taking it, Nicole. Um, yeah, I think it's a great product.
Yay! Let's see. Do we have any more questions while we have our lovely expert here? Oh, and you're gonna be speaking on women's health for May, correct?
Yes. Hmm.
Gonna be a great one.
Hmm.
So it kind of ties into the whole thorn prenatals, so to speak.
Absolutely.
Totally
Yep.
didn't. do that, but it didn't work out. So that'll be a great one, everyone, too. Um, so mark your calendars, and um, there's also going to be a make your own handmade Mother's Day journals class. You can make like a little photo book for your moms, or bring your mom to it and have it be a little fun activity. So that'll be wonderful, tied into Mother's Day. That's May the 11th. But um, also, March is going to be a really, really good month as well. But um, this month is very important for self-love and heart health. And um, we have to stay happy and healthy. So,
Exactly. Yeah, find some ways to give yourself a little love this February and keep working on supporting your heart health.
yay! Thank you so much.
You're so welcome. So lovely to be here.